Welcome back, everybody. We've got some health news for parents out there this morning. If your child is having difficulties eating or sleeping, it could be tied to a commonly undiagnosed condition called tongue tie. And joining us this morning to talk more about this is board-certified pediatric dentist Dr. Rez. And Dr. Rez, first of all, thanks for being with us this morning.
Thanks for having me.
When we think of tongue tie, we think about sometimes a news anchor who might get tongue-tied, but this is actually a condition that is serious and that can affect children. Tell me what it is and how it does affect patients.
Sure. So we all have a band of tissue under our tongue that connects our tongue to the floor of the mouth. We also have the same band under our lip that connects our lip to the jaw. Sometimes that band of tissue is too thick or too tight, so our tongue and lip don't have the normal range of motion, normal mobility. This is something that we pass on to our kids, and when it goes undiagnosed and untreated, causes a lot of health issues for us.
And health issues, anxiety. What are some of the things that the kids have to go through if they have this?
Sure. So in our infants, we see very poor latch when they're trying to nurse. Very often the latch is very shallow. They're having this hard time just getting the milk from mom. Their lips can't create a good seal around mom, so they leak a lot of air. They're making a lot of clicking noise. Nursing becomes a very frustrating, painful experience for them, and a lot of times they're having a hard time. And of course, for moms, they get a lot of mastitis. In older kids, we see a lot of speech issues. We're seeing kids showing up with lisps and also inability to pronounce their R's, Z's, just to talk clearly, if you will.
And what are some of the treatments? How can people, get some relief or some treatment?
Treatment is easy. Now we use, with the technology we have, we use the latest laser that we have. It's a 10-minute procedure. We cauterize that band of tissue under the tongue and the lip. The pain is very minimal, and no bleeding, no need for sutures. It's a same-day treatment, and most of the times we see immediate improvement, or within a couple of days improvement in speech and in nursing.
And where can people get in touch with you or find you if they want to maybe learn more about this or go through a treatment?
Sure. We encourage patients to visit us on our website, islandspediatricdentistry.com, or just call the office at 602-491-1818, or just simply find a different provider in their area that does the service using laser. The key is using the highest technology, and it's somebody who's very well trained, because unfortunately the challenge we have is most of the doctors in the country are not trained to appropriately diagnose and treat this very easily treated condition. So we have all these kids who go undetected and suffer greatly with something that's very quickly treated within 10 minutes.
Well, now that you're giving the information, people who may not have been familiar with what this actually is, they now know what it is, and they can seek some treatment, because it really could provide relief for a child out there.
Absolutely. We're committed to providing this service to as many kids as possible, simply because it's gone undiagnosed and untreated for such a long time.
Well, Dr. Rez, thank you so much for joining us this morning, and good information there, things that parents need to hear about.